So thank you very much for all of you for attending this webinar on providing practical guidance on training humanitarian actors to collect quality data on persons with disability. My name is Pauline Tivillier. I work for Humanitarian Inclusion, and I've been the project manager on the project called Collection of Data on Persons with Disability in Humanitarian Action. I will be the moderator today, so you won't hear much from me anymore. The webinar is going to run as follows. We're going to have 4 presentations talking to you about the Washington group, the learning toolkit that was produced, the training pack, and also experiences from the field. And there will be a lot of time at the end for Q&A. The first presentation will be on using the Washington group question in humanitarian settings and will be delivered by Ola Abu Alghaib from Leonard, Cheshire Disability. The second presentation will introduce the learning toolkit created by Humanitarian Inclusion, and Kate Aykroyd from HI will be delivering the presentation. The next presentation will be on how to use the training pack. It will be delivered by Carly Ziska from Radar, UK. And the last presentation will be about what to look for, talking about challenges and solutions when delivering training on the Washington group question. And Carissa Gala from Humanitarian Inclusion in the Philippines will be delivering this presentation. The Q&A at the end will work with the chat. So if you have any question about any presentation at any time, feel free to write your question directly in the chat. And we will be answering as many as possible at the end. So without further ado, I'm going to let Ola introduce our presentation and the Washington group question in humanitarian setting. Ola, over to you.
Good morning, everyone. As Pauline said, we are very excited to see that we have managed to attract a quite high level of attendance today, and we hope that you will find our input very useful to you in your fields of expertise. My input will be mainly focused around sharing the learnings and the understanding of using the Washington group questions beyond the national data collection mechanisms. But to start with, it's really very important first to understand why is it important actually to collect data on disability. And this has been a question in mind for so many years to understand why it's important and how it needs to be administrated and at which level and by whom. So today we will try quickly to answer a few of those questions in a way that can inform your daily work. Of course, answering the question of why, we need to understand how many people with disabilities are there in a certain community where you need to work in, if you are ensuring that you are inclusive to those community members. So understanding the numbers, understanding the scale, and the types of persons with disabilities you will be engaging with is very critical. The additional element is, of course, if we want to ensure equitable access and impact of services provided, again, we want to have an indicative understanding at the beginning on what kind of allocations and additional resources we need to build in programs to ensure that they are responsive to the specific needs and rights of persons with disabilities, additional to other community members. The third element is, of course, around assurance of accountability and transparency, because the more evidence is there, the better it is to understand gaps, but also to push for more change from representative groups and civil society organizations. And the fourth element is, of course, it's really contributing, whether it's at national or community level, to these global commitments around disability that are usually made not only by governments, but also by development actors, by donors, by UN agencies. So the more data we have, the better it is. Quickly, just to understand the types of data usually that are present. We know that there are data available at national level, where it's more administered and analyzed by governments, and it's usually by census, national surveys, but also through the administrative data. Today, our focus is more around the third level, which is more the program level, and understanding more deeply how the questions and are the questions useful to be used within that space. So what are the Washington Group questions? Since 2008, there has been a global agreement that we need to commonly understand how to collect data on disability and unify the methods and the methodologies used around it to ensure we have consistency of understanding of the prevalence of disability, but also having the ability to compare across countries and across types of disabilities in those countries. So the questions provides ability to understand the prevalence and monitor the level of functioning in the population. They are not meant to be used as a diagnostic tool or a targeting tool. And of course, there was an evolving understanding and advancement of methods used in relation to the Washington Group questions, started with a short set, but extended beyond that to more questions to have this wider understanding, but also there were more modules around children functioning. We have more now testing around the labor force surveys, a test and a module under development for the mental health. And of course, there is a wider environmental and participation consideration as well around it. I will not go through the questions because I'm sure the audience is familiar, and if not, the presentation will be shared with you and you will have it as well. And there is a lot of information out there explaining the questions. But more our interest today is to explain to you the added value of using the questions in programs, which is really what was really appreciated by the participants that we looked into in this combined research that I'm very keen quickly to share with you the findings around by development and humanitarian actors. And we wanted to see, as I said earlier, are the questions effective to be used in a smaller scale programs in humanitarian settings, additional to development settings as well. So we, of course, wanted to understand that from people who are in the field. So we looked at people, organizations implementing those practices, but also we wanted to understand it from the donor's perspective. And what we found that the use of the questions were really very useful, even beyond the understanding the quantitative element around it. They were also very useful in terms of changing the dynamics and the culture within the organizations and the communities that the practitioners use them in. But we were very careful also to highlight that there were some misconceptions and limitations to the use of the questions. We need to understand, again, they are not diagnostic tool and they have limitations of coverage. For example, in terms of mental health, they are also alone can't give you in your programs a deeper understanding of how inclusive your program is, but they can give you indications while designing, implementing, and evaluating the programs. The last and most important element to share with you from the findings of our study was the importance of training. It was very clear that training should be a cross-cutting strategy if we want to use the questions and if we want them to be informing our thinking. So training not just on the use of the questions, but also understanding the communication ethics around disability, understanding why disability is important is very key. And also it should be, as I said, continuous, because there are huge risks if we decide to administer the questions without taking into consideration training the people who will collect the data and analyze it, because we will be falling into a risk of having inconsistency of the data we are gathering. We also, from the field, we have captured that there were huge issues in terms of if we don't provide the proper training and coaching to people when collecting, they ended up adding a question, which is, do you have a disability? Which we know is problematic because automatically families tend to block out once they hear the word disability to report if they have a household member with a disability. There were also issues with the limitations of misusing the questions in terms of understanding the realities of the people reporting about the levels of the limitations they have. So in shortage, training is essential, and we advise you all, if deciding to use the questions, is to embed it across all the elements. And there are so many resources out there, and the toolkit that will be presented later is one of the key resources we advise you to look into. There are also other resources that will be shared with you that provide you with a landscape of the disability, Washington Group questions, and the report and the data portal that we have developed, as well as Leonard Cheshire, which also can give you a landscape of the national data sets available for people with disabilities. Thank you very much.
Thank you very much, Ola, for this very interesting presentation. Yeah, Ola went briefly through the Washington Group question, but if you have any question, again, you can ask question in the Q&A, and we will be able to answer it at the end. Ola, it was really great for you to be able to share your experience on the use of the question, and also, you know, explain why training on the Washington Group question is so essential. So we're now going to move on to our next presentation, which is going to be delivered by Kate Aykroyd from HI. And she's going to be talking to us about resources available for humanitarian actors to train on the Washington Group and the recent learning toolkit that's been launched. So Kate, over to you.
Thank you, Pauline. So I'm just going to talk you through the learning toolkit that we have launched as part of HI recently, and it links very nicely to what Ola has just been presenting in terms of the importance of training in humanitarian action when using the Washington Group questions. So firstly, just to present a little bit about the project of which this learning toolkit has come from. We've been working for the last few years on a project collecting data on persons with disabilities in humanitarian action using the Washington Group questions. And it was built in 3 phases. So we started with an action research where we were testing the use of the questions in this context to see how they worked and what their limitations were. A lot of those have already been shared and referenced by Ola previously. From there, what we were able to gather was the importance of training when it came to using the Washington Group questions. And so phase 2 of this project has been to create learning materials to support humanitarian actors. There are existing materials out there on the use of the questions in national statistics, but it's not so adapted for the context of humanitarian action. So the learning toolkit that I'm going to present to you now is very much something that's been created for field staff or program staff who are looking to use the Washington Group questions. Then the final phase, which is the phase we're in now, which is the dissemination and advocacy, which of the learning toolkit to ensure that you all have access to it and can make the best use of the tools now available. So this is the learning toolkit, just to highlight that it's available on the HI UK website, but it's also available on Disaster Ready and Kaya Connect. So to start with, it's built into, in the learning toolkit, it's built into many different materials. One of the main pieces of materials that we've created is an e-learning. This e-learning has been created in an information sharing way as opposed to a testing learning kind of way. So it's information rich with lots of resources included in the e-learning that you can download as you go and also at the end. It's built in 4 modules to give what we felt from the action research and the testing were an introduction to areas that were all essential when it comes to training on the Washington Group questions. So the first module is around understanding how to identify persons with disabilities using the human rights-based approach. Module 2 is around the importance of collecting data on persons with disabilities. Module 3 is it's a longer module. This one's about an hour long, and this is the real sort of the how to use the questions in your programming. So it's a real reflection. It's sort of talking you through the planning process, as well as some scenarios on using the questions themselves. And the final module is quite a short module. It's a snapshot. We would have loved to have done more, but it's looking at the analysis of the question. So there's some short videos showing some of the steps that need to happen for the data to be correctly analysed and then used. So as I've mentioned, this e-learning is present on 2 external platforms, Disaster Ready and Kaya Connect. It's about 2 hours in total, and it will be launched in the coming days in French and Arabic as well. It's fully accessible, and it should also be available, particularly if you use the Kaya connection. You should be able to download on your mobile and on tablet with no problem. One of the other tools that we've created as part of the Learning Toolkit is a flowchart. This is an online link. It's also an offline PDF to help understand the planning process you should go through when thinking about using the Washington Group questions. As Ola has already mentioned, it's not always necessary to use the questions, or it's not always the right setting to use the questions. So here with the flowchart, it's a way of visualizing when you might be looking at other sources of secondary data in order to have access to data on persons with disabilities, and when you should be looking potentially to use the questions. So this is it's a tool that I would recommend that you take a look at and see if it can be useful to understand when to use the questions in your programming. In addition, we have created a planning checklist. This mirrors module 3 in the e-learning. And it's a step-by-step checklist to some of the things you must take into account when thinking about using the questions. The reason this tool was particularly created was because a lot of the error that we saw in the action research when it came to using the questions was due to people rushing in, using the questions very quickly, and then not thinking about some of the key steps beforehand as to whether the questions were firstly the right questions to be using, and also whether they were being used in the correct place within a data collection tool. A resource that we've created to support specifically for enumerators is a How to Ask the Washington Group Questions Do's and Don'ts guide. This is a short pamphlet that you can print and hand out following trainings to enumerators. It summarizes some of the key elements, the key do's and don'ts, the key messages, and some of the key pointers when it comes to translation, that ensure that if an enumerator hasn't been trained for a while, or potentially they haven't been able to be trained, it provides them with some of the real key messages that they need to have to hand. And finally, this is something that we're going to go into in a bit more detail now in the rest of the webinar, is the training pack for enumerators. This is a face-to-face manual that we created with Radar UK, and I'm very pleased that we've got Carly here to talk us through that this particular tool in much more detail. So I'm not going to go into it anymore, but it will be also available in French and Arabic in the coming days. So that's the training pack. As I said, it's available in different places. It's also very much available for you to use and adapt as is best for your needs. We really hope that it's something that is useful for you all in the field.
Excellent. Thank you very much, Kate, for the overview of the Learning Toolkit and the many resources it includes. It is really great to see that it's available open source for everyone to access and in multiple languages, and being designed with field staff in mind. Just a reminder that we will be sharing all the slides of the presentation, as well as the link to the report that Ola mentioned and the toolkit that Kate presented with you after the webinar. Again, please feel free to use the Q&A or chat function to ask any question you may have or any clarification you'd like us to discuss at the end of the webinar. We've left quite a lot of time for questions. But yeah, without further ado, now we're going to move to Carly from Radar UK, who's going to be talking to us in more detail about the training pack and how it can be used. So Carly, over to you.
Great, thanks Pauline, and thanks to Kate and Ola for introducing us so far. So Radar UK is really excited to be part of this project. I am going to just be talking about the face-to-face training pack specifically, and give you an overview, and then talk a little bit about one of the sessions in detail so we can see how it's structured, how we kind of use it, and then of course there'll be time for questions. So just a quick overview on the training pack, we're going to just talk about what it is. So it was designed to provide sort of the tools for anyone who has to train enumerators in humanitarian action. So anyone who is training enumerators, data collectors to use the Washington group questions in their specific context. So it's designed for anyone who has done training before, has never done training before, but who wants to work with enumerators in the field who are going to be going out and using these questions. So it is very user-friendly. The audience is just any staff who have responsibility for training enumerators. So that might sit within a monitoring evaluation team. It might sit within a programs team. So it can kind of be adapted for any kind of use there. So I want to talk to you about how the training pack is structured. So give you a quick overview. As Kate sort of mentioned, this is the cover of it. So there are 6 core sessions, which I'll talk about in just a second. Every session comes with a variety of customizable activities or optional activities. So you can choose based on your audience and based on your context, which activities are right for you and your enumerators. There's also trainer notes, which go through exactly how to run the activities. There's also notes to the trainers about the language that we should be using, about how to facilitate the activities, how to use the handouts. There's printable resources included in this guide. So at the end of every session, there are handouts. I'll show you some examples, but there are handouts that you can print or photocopy right out of the guide and use during the sessions. And then there's also, as Kate mentioned, there's PowerPoints associated with some of the sessions that you can use depending on your audience. And they're all included in the downloadable link that is available on the HI website and on a few other places that we can point you towards. So each session is broken up into a few main pieces. So there's the session title, the number of minimum minutes and maximum minutes. So because the sessions are customizable, they can take shorter or longer depending on how much time you have, depending on who your audience is and what you want to get out of that session. Every session has an aim about the broad outcomes. They have objectives about concrete things that the participants will be able to do or achieve at the end of the session. There's key learning points, which are things that the participants will have to know, and there are also notes for the trainers about, what certain terms mean or how to use them. And then there's a section called linked modules, so it tells you what other sessions that session is related to, and this is an introduction session, or maybe this is a bit more advanced session. And then there's also the context in which it should be delivered. So in the session overview, it tells us the number of minutes, the activities, the handouts. So there's a list of handouts, including the titles, so the PowerPoints, the photocopied resources. There's trainer instructions for each of these. So they tell you how to go through the session. And then in red are optional activities. So some of the activities you can choose and say, I think this one will work better for my group, or we already have foundational knowledge in this, so we don't need to use this activity. And so you can, as a trainer, you can go through and pick which will be useful for your enumerators. So we've got the session overview, we've also got the detailed methodology, and then we have the supporting information, so those are links and resources. So I want to show you sort of a how do I use it? So we're going to look in detail at one example. We're going to look at the first session, but before we do that, I'll just show you an overview. So these are the core sessions. The 6 at the top are sort of the core data sessions. And then there's also some additional sessions. So if you're doing this training over 2 days, you might want to do a daily recap or a morning review. If you're doing an evaluation of the training, you can also add that session. So there's a few different options. Each has the minimum time and the maximum time. So the maximum time would be if you included all of the activities, and the minimum time is just sort of just the basics. So we're going to go through key concepts of disability quickly, just so you can see sort of how the session looks. So it's the first sort of session on content. It has optional activities that you can choose based on the pre-existing knowledge of the enumerators, so what they may or may not know about disability. Depending on their level of English, some of the activities work well with participants who are really proficient in English. Some of them are appropriate for all levels of English language speakers. And then also your resources available. So depending on if you're in a field site where you can't do printing or where you can't do PowerPoint, there's also some options there. So this is what the overview sort of looks like. So you can see it's between 85 and 100 minutes. We can look at the aims and objectives for this session. So it is an introduction to disability and familiarizing participants with that rights-based approach that Kate mentioned. They'll be able to define disability, look at barriers, and then use appropriate language. These are the key learning points for that session. So if you as a trainer need a little refresher, or these are the things that I need to make sure I tell the participants, that's there for you. There's also in the overview, you'll see at the top here, we've got handouts and resources. So there's a PowerPoint that's included that you can use. There are some activities that are associated with different options that we'll go through. There's the time on the left, so it tells you how much time each activity should take. And then there's the trainer instructions. So for this first session, you have these guiding notes just to kind of keep in the back of your mind as a facilitator. And then we've got option 1 down here. It's an activity that introduces participants kind of the concept of disability before we get into some definitions. These are just a few of the handouts. So these are all included in the session guide. So at the end of each session, so you can print them off or photocopy them or write them out. And it tells you how to cut them up and how to use them in the session brief. So they're all included in there. There's nothing additional that you have to download or print. So there's also additional activities. So if you look here, this activity that I've just mentioned works best with participants who are really proficient in English. But if that's not the case for your group, that's completely fine. There's another activity that goes through the same concepts, but in a bit more of a visual way, a bit more of an interactive way that works with all levels of English. And also, as Kate mentioned, these can be translated into French and Arabic. So there's also some options there. So these are the directions, and each session has directions that are very detailed for the activities. There's also some that are, optional. So this is all in the first session. So if your participants need a more in-depth background to disability, you can go through this PowerPoint section. If they're already very proficient in those concepts, you can skip it to save a little bit of time. And then there's some trainer notes in every session which tell you, you can use laminates instead of PowerPoints if you don't have electricity or if you don't have screen capabilities. So there's some adaptations that you can make there. So that's just one example of one of the sessions. Every session is structured in the same way with those optional activities, with those, option 1, option 2, option 3. And as you go through the guide, you'll see that there's quite a lot of flexibility there. And there's also notes for, if you're in this context, you can change this. If you're in this context, we recommend that you do this. There's notes for the trainers. And then of course, there's all of those additional resources. So if there are questions about the training pack, please feel free to just pop them in the question and answer box. We'll answer any of those at the end, and I'm happy to talk more about this.
Thank you very much, Carly, for a very interesting presentation. Being someone who's used the training pack, I can say it's very well designed. It can really be adapted to your needs and how long you need and how long you have to deliver the session, as well as having all the activity and the support you need, and the sessions are very interactive and participatory, which is always a nice thing. Once again, please feel free to use the Q&A facility to ask any questions you may have. We will have a lot of time at the end to go through them. Last presentation, we wanted to finish with an experience from the field. So we have Carissa from HI who's going to talk to us about her experience on delivering training on the Washington group. So Carissa, over to you.
Thank you, Pauline. Hello, everyone. I'm Carissa Galia. I'm here to present about challenges and solutions when delivering training on the Washington Group of Questions in practice. In my experience, training and capacity building on the Washington Group of Questions can be very varied, and each has its own challenges and solutions. For example, sometimes training can take the shape of a presentation in a conference. These are still critical opportunities to share information, to correct understanding, and to ensure that those attending have access to information that supports the understanding and use of the Washington Group of Questions. One example I have of this was presenting at the Asian Ministerial Conference in Ulaanbaatar, Mongolia, last July 2018. The objective during the conference was to promote the use of the Washington Group of Questions. The main challenge was the fact that I was given a short period of time to present, so the information that was shared had to be strategically brief. A lot of the participants probably have never heard of the Washington Group of Questions, so the challenge was, how does one explain it briefly to a specific type of audience? How does one convince participants to use the Washington Group of Questions if those participants have never tried and heard of it? Also, during the conference, an additional concern from another presenter was a confusion over whether it is optional or not to collect disaggregated data on age, gender, and disability. These challenges can be addressed using the different resources from the Learning Toolkit. For example, the training material Introduction to the Washington Group of Questions provides information that can help explain the Washington Group model and question sets. Helpful links from the webpage provide supportive information on the fact that the Washington Group of Questions has been tested in several countries, that it is recommended by the United Nations Statistical Commission, and that it has been endorsed by the Disability Data Expert Group with the support of the United Nations Department of Economic and Social Affairs. In addition, the training manual for enumerators provides an explanation on why disaggregated data is useful in humanitarian contexts. The action research resources, specifically the research protocol, disability statistics in humanitarian action, and the summary review of the use of the Washington Group of Questions provide very useful information that indicate how the collection of data disaggregated by gender, age, and disability is not an option, but that it is required by the UN Convention on the Rights of Persons with Disabilities, the Sustainable Development Goals, and the Sendai Framework for Disaster Risk Reduction. Another training experience that I had was a pre-crisis information mapping survey and consultation that we conducted on December 2018. The activity was organized by the Humanitarian Country Team's Community of Practice on the community engagement. The Community of Practice is composed of various UN agencies and international and local non-government organizations. The purpose of the activity was to identify the preferred humanitarian aid of at-risk communities in an event a typhoon similar or greater than Haiyan, locally named Yolanda, happens again. The data will be used to inform the medium to large-scale typhoon contingency plan developed by the HCT, or Humanitarian Country Team. The pre-crisis mapping took place in Pinupuk Municipality in Kalinga Province, which experienced a large-scale disaster in October 2018, brought about by Typhoon Mangkhut. One of the challenges during the training was the limited time provided for me to train enumerators. As a result of this, the topics on orienting enumerators on the concept of disability and orienting on enumerators on how to interact with persons with disabilities were not covered during my training. It is important to highlight that ideally there should be an ample amount of time invested to train enumerators on how to use the Washington Group of Questions. But in some instances, when you find yourself working with other factors that you cannot control, this is not possible. However, the resources found inside the Learning Toolkit will prove very useful. Again, I find the handout on how to ask the Washington group of questions very helpful. It can be briefly discussed during the training and can be used during the actual interview as a quick reference guide for enumerators to learn what to do and what not to do during the interview. There's also an Excel handout showing an example of dataset and template that can be used by enumerators in the field to reflect disaggregated data. Another experience that I would like to share with you was a training to government officials and disabled people's organizations in Camarines Norte last September 2018. Camarines Norte is a province located in the Bicol region of the Philippines, known for its beautiful coastal communities, and it is also known for being highly exposed to different hazards such as flooding, landslides, earthquakes, storm surges, and cyclones. The training's main objective was to strengthen the capacities of Camarines Norte's government officials and disabled people's organizations to collect data that is disaggregated by gender, age, and disability using the Washington group of questions. During the training, it was observed that one of the main challenges for data collectors who have not been trained on how to use the Washington group of questions was a tendency for enumerators to have biases about disability, and the tendency for both the enumerators and respondents to have negative connotations about disability. During the training, it has also been observed that there was a perception that collecting disability data can only be done by experts, and therefore enumerators tended not to have confidence when it comes to collecting disability data. To counter these challenges, as a trainer, I find the training manual for enumerators very useful. It provides information about the different models of disability, the barriers faced by persons with disabilities, and the definition of disability in the framework of the UN Convention on the Rights of Persons with Disabilities, which removes stigma around it. In addition to what I just shared, there were two other components of the training that officials from the Persons with Disability Affairs Office appreciated and expressed a special ownership over the output produced. The first is a simulation activity during the training, and the second is a translation of the Washington group of questions to the local dialect in Camarines Norte. Referring to the first component, one of the structured activities in the training is a simulation activity. I observed that enumerators tend to get carried away by the respondents' answers and tend to choose the answers themselves. For example, when respondents tend to provide vague answers instead of choosing from one of the 4 response categories, enumerators tend to select the answer and fail to guide the respondents to choose from the 4 response categories. To address this, both the training manual and the handout How to Ask the Washington group of questions provide information that can be used by enumerators during simulation and actual interview activities. The handout can help the enumerators locate where they are in the interview process and easily regain their composure when enumerators are sidetracked by the respondents' answers. Overall, trainers find the simulation activity to be very useful in helping enumerators improve their skills and build confidence in using the Washington group of questions. On the other hand, putting the questions into the local dialect prevented enumerators from spontaneously translating the questions during the actual interview. When spontaneous translation happens, biases from enumerators are injected to explain the questions. This results in adding stigma on the definition of disability, and this is what we want to prevent. Translating also involves a consultative process to capture the same content of the English version. The training manual for enumerators has a specific section for translation guidelines of the Washington group of questions. This section also explains the value of translating in a consultative process, wherein the translation is arrived at and agreed by all translators, thereby preventing variations in the questions being asked and allowing comparability of data being collected. In summary, going back to my first point, conferences and events can also provide capacity building and can be very good avenues for sharing learning about the Washington group of questions. For my second point, it's always better to invest time for training. When you have time and can complete a full training, the results will always be improved and the data will always be better. Make sure to conduct field testing activities to observe the enumerator's quality of data collection and conduct of interview. Make sure to conduct a consultative translation before the interview to prevent on-the-spot translation. Trainings and simulation activities in the trainings are the best opportunities to observe mistakes and to check how enumerators understand how to use the Washington group of questions. Results will always be improved and the data will be better when time is properly invested and full training is provided. However, when this is not always possible, focus on ensuring that the lowest amount of error is made, that the questions should not be changed in any way. Lastly, collecting and using disaggregated data helps to determine who is accessing humanitarian assistance and helps to determine whether the assistance is inclusive of persons with disabilities or not. Thank you, Pauline.
Thanks a lot, Kara, and thank you for talking us through what it is in practice to train enumerators on the Washington Group, and what are the challenges, but also that there are solutions. So it was very great to hear this. Okay, so that was the end of the presentation. We're now going to move to a Q&A. We have already been collecting some questions in the chat and in the Q&A facility, but please continue asking your questions. I'm going to take them in order. The first one, I'm going to come to you. And someone asked if it was possible to get maybe a bit more of a definition of disability, and I think especially the definition of disability underpinning the Washington Group question, as not everyone attending this webinar is disability experts. So could you please tell us a bit about this?
Yeah, of course. I mean, that is a very important and good question to ask, because the definition of disability is very essential to understand who does the community or the government or the actor is considering as a person with disability. And the reason I'm saying it is challenging, because there has been an evolving understanding about how to define disability. So previously, many years ago, and it's still the case, unfortunately, in many countries and contexts, we're still looking into disability and defining it very purely from medical perspective. So it's purely narrowed down to the level of looking at the impairment and defining the individual as per the impairment they have. And there are also other definitions that are related to the issues of charitable approaches and looking into disability more from stigma and defining the person again using certain wording related to the type of impairment they do. But when the convention was adopted in 2006, even though there was no clear global adoption of a definition, but there was understanding and agreement globally that disability is an evolving concept, and that disability results from the interaction between the person with the impairment and the attitudinal and environmental barriers that hinders their full effective participation in society on equal basis with others. What does that mean? That means, yes, we do recognize that that the impairment exists, but on its own, it doesn't define who is the individual and the level of disability they have, because we know that environment around the individual matters of determining the level of inclusion and participation they do. Now, coming back to the Washington Group questions, they did consider this wider understanding around disability. And for those who are familiar with the International Classification of Functioning, the International Classification of Functioning, which is used usually in governments as a mechanism to understand more deeply the level of the impairment and the percentage of disability. There are, of course, still problems with it, but it still considers disability beyond the impairment and looks at the activity and the level of participation and the impact of the environment around the individual that looks into it. Now, again, coming back to the Washington Group questions, one of the issues about defining disability comes to the level of, when I showed in the previous slides, how disability is defined. In the questions, the answers are 4 options. So the person could say he has no difficulty, he has some difficulty, he or she has a lot of difficulties, or can't do it at all. Some countries tend to only define the disability on the threshold of can't do it at all, because they know that once they do that, then the percentage of disability is reduced. But in more of the developed countries, they also consider answers around yes when it comes to a lot of difficulty, and that brings the percentage much higher up. Now, coming to programs, again, this is a decision to be made. Where do we draw the line and put the cutoff? When we are analyzing the data, when we gather it, around when we collect the information as per using the questions, because it matters a lot between sometimes 2% and 7%. If we use the cutoff around yes, a lot of difficulty and can't do it at all, or just center it around can't do it at all. Thank you.
Thank you very much, Ola, for providing that clarification. Then we have a couple of questions regarding translation, and I'm going to go to Kate on those two. So Kate, the first one is about whether the Washington Group question were translated into Arabic, as there may be problem in conveying the meaning of the question in Arabic. And the second one was whether the material this time, so the learning toolkit, was available in Spanish.
Hi there, two very good questions. So starting with the Arabic questions, so the questions have been translated into Arabic, but not officially. And what I mean by this is the Washington Group has allowed for lots of different translations. People who've used the questions in their context have done translations. And so translations on across multiple languages exist. However, they're not official, so they haven't necessarily been tested to the same extent as to the English version. So at the moment, the Washington Group are going through a process of collating all of the translations, and they will be putting forward their recommended translation that they have available. So if you'd like to get access to these, the best option is to contact them via their webpage on the Washington Group, and they will share that version with you. For the purpose of our project and for the use that we have within the learning materials, we've used a set that was translated in Oman, and it's available within the Arabic version of the e-learning as well. And I'm more than happy to share that. But it's the version that we've used, but it's just to caveat with the fact that it's not an official version, and an official one doesn't exist. I know for Arabic, as you mentioned, it's very difficult to capture some of the meaning. It's really important to try and go through some testing. So as Cara was saying in her presentation, the translation, if you are going to undertake a translation yourself, it's very, very important to follow a translation protocol that the Washington Group also share on their website, so that you can ensure that you are capturing the correct sense and meaning that's behind the questions. For Spanish, sadly not. So we, as part of this project, we were working in both Francophone and Arabic-speaking countries, and so those are the two languages that the toolkit is in. We would love to translate it into Spanish, but it's currently not available, unfortunately.
Thank you very much, Kate, for those clarification. Yeah, translation of the Washington question is one of the remaining challenges. I'm going to go to Carly for the next questions. There was question, Carly, and a few of them about how long is the training pack overall, and if you could tell a bit more about the module and the different options regarding the time that can be dedicated to training. Thank you.
Yep, sure. So like I said, the training pack is really very flexible, and so it's not a simple answer, but it does kind of depend on how much time you have to dedicate to training. I know that it's really difficult to get 2 days of time in an emergency or in a field context to have enumerators sit in a room. So the answer is that if you were to do every session in the training pack and every activity for every session, it would take about 11 hours, which would be 2 days of training. But that's not probably what everyone needs, and that's probably not what everyone can dedicate themselves to. So if you were to, if your enumerators had an idea about disability, maybe they had like a good definition of it already, maybe you're working with a version of the Washington Group questions that have already been translated, you probably only need to, choose one of the sessions, and maybe it's that session on collecting data using the Washington Group questions. So it would probably take you about 2 hours. So it really is, but maybe if your enumerators have never worked with people with disabilities before and they have never heard of the Washington Group questions, and you don't have a working translation of it, you would want to add some of those other sessions to make sure that the enumerators are really well equipped to use these questions in an appropriate and sensitive way. So it kind of depends on the audience. There are some documents in the training pack that will help you choose. So there are some documents that ask you as the trainer, some questions about, you know, who is the audience, what's their pre-existing knowledge, what are like the most important things that they need to get out of this training. And then you can go through the sessions and say, okay, I need this, I don't need this, I need this, I don't need this. So you can kind of piece it together.
Thank you very much, Carly, for this clarification. I'm going to go to Carissa next. There was quite a few questions, Carissa, on the challenges that you discussed in your presentation. And you mentioned that, you know, when you were short of time, you were able to cut out some module. So what the participants have been asking is if you could explain kind of what you decided to cut out when you didn't have time to train participants on everything, and what would you recommend prioritizing in terms of training Enumerator? Thank you.
Oh,
Carissa, I'm not
sorry,
sure you're muted
yes,
yourself.
I'm sorry.
Yeah.
I think like what I said earlier, it's ideally better if ample time is invested in organizing trainings and making sure that there is a topic on the concept of disability. Usually one of the biggest errors of enumerators is injecting some phrases before they start the interview. They sometimes inject, I'm going to ask you questions about if you have a disability or you don't. So it's really important that you go over the topic on the concept of disability, and you go over the topic of how to interact with persons with disabilities. But because sometimes there are factors that we cannot control, and it's impossible to find time to go over those topics. The handout, how to ask the Washington group of questions, really have proven to be useful, because it gives you a what to do and what not to do instructions, and it's very simple the way it is presented, the way it is shared. It tells you never to ask, never to mention disability. It tells you also how to interact with persons with disabilities, with different disabilities. So it's really a good guide for enumerator, especially those beginning, and you can quickly go over it before the actual interview. You can give a short amount of time for it during the training.
Excellent. Thank you very much, Carissa. There's a lot of questions and the clock is ticking, so we're doing our best to answer them all. We will provide a written answer to the question we cannot answer today. For my next question, I'm going to go back to you, Ola, actually. There's a few questions around stigma and the use of the Washington Group questions, and whether this is actually better to identify people with disability in a non-stigmatizing way. Can you talk to us a bit about that, Ola, please?
Yeah, well, this is one of the huge challenges, because for example, in Palestine, my country, when we used the questions at the national census, we were surprised that the prevalence indicated was much lower than we thought, because Palestine is a country of conflict, and there were much higher, I wouldn't say much higher risk, but the expectation was that we would come up with a higher percentage. And we tried to understand what went wrong, because it was the first time the questions were used. And one of the things, so we ran a research to understand, so we went through households that were interviewed to understand whether they actually reported on, even though the questions, we know that when they were drafted, there was very careful design of the wording in a way that it runs out of any stigmatization or any indication to the household members that we are actually labeling the individual to have a disability, because you can see that none of the terms used actually indicate disability in it. Yet we know there are some mistakes happening in the data gathering process, which gives the indication that we are asking about disability, and then automatically there is a block either from the household's key member or the individual himself to report themselves as disabled. The questions themselves can't be used to fight against stigma. Yet, again, the process needs to be correct, and that's why the training and all what we mentioned today is very essential to try to run away from the risk where stigma can influence the findings. Yet, of course, as I explained earlier, to change the way the programs and the targeting and the assurance of equality of access for people with disabilities in these programs, we need to accompany other data collection measures, other interventions to ensure that stigma is addressed, that awareness raising, sensitization is assured by the program implementers and by the community members to run away, as I said, from the risk of stigma as a cause of exclusion for those individuals to be targeted or even counted.
Thank you very much, Ola, for this clarification. There were a lot of questions as well around the analysis of data, and I'm going to take those. It's the moderator power. So the analysis of the data using the Washington group is a question that comes often. It is tackled in the e-learning in the last module that Kate presented. We kind of go through how you can analyze the 6 question of the Washington group, the different threshold or cutoff that can be used to define and identify person with disability. So we kind of walk through this. We've made a little Excel video because it's much easier to see than, kind of talk you through already. So I recommend you check those. We have 3 minutes left, but there's one last question that I think might be a nice ending question for this webinar. And Ola, I'm going to come back to you again. Someone says it's great to have all these resources. Have any resources been developed for development setting rather than humanitarian, as this learning toolkit is focusing a lot on humanitarian? And yeah, you mentioned that the question was used by Christian Aid to conduct survey. So they wanted to know, if our resource is going to be available for development actors, and is there any good example or good practice in development you'd like to share?
Yes, so the report that we will share the link with you actually combines the learnings from both development and humanitarian practices. And when we looked at it, of course, many and more the case now, with donors picking up the importance of disability, we know that mainstream actors are very keen to look into disability and are required by donors to use the Washington Group questions. So the report will give you some indications of learnings from the people or the practitioners or the programs that looked into the use of questions. And we are actually now also looking into developing specific training materials and modules that will support and will be closely aligned, of course, with the work with colleagues from Humanitarian Inclusion to bring that additional perspective. I wouldn't say it will be so much different, but of course, maybe the landscape will be different because we know in humanitarian context, there are specificities to be considered, in terms of sometimes the limitation of the use of the questions or the nature of the populations, because it is really coming with different perspectives and nature. So as I said, the report could give you some indication, but we are more than happy also to reach out because we have a lot of learning through our own practices in the field, and we support a lot of mainstream organizations to use the questions because our research center is hosting the Washington Group Secretariat, so we're more than happy to do that with you.
Thank you very much, Ola. And I'm afraid this is all the time we have for this webinar. So I'm going to thank all the speakers today. And I'm going to also thank all the participants for the questions that were shared. We were not able to answer them all. We will try to provide some written answers to you all. And maybe just to wrap this up, so this learning toolkit is really an entry point on the use of the Washington Group question in humanitarian action. And as Ola said, there are some parallel with development. It is the start of the conversation, and a lot of the question you had around analysis or use of the data for inclusive programming will require more work, but equally a lot of the question we've seen can also be answered by the e-learning. So please, I recommend that you all take it. We will be sharing the recording of this webinar as well as all the resources that were mentioned with you all. And I think there is a short poll that should be appearing on your screen for kind of us to let you know how you found this webinar, whether this was useful, and what you would need going forward. But once again, I want to thank you all very much for attending this, and we will be in touch with all the resources. Thanks a lot. Bye.